This is chapter 12, recording 1. We'll be talking about shock in this chapter. So shock, also known as hypoperfusion, describes when your body can't meet the oxygen and metabolic demands of the body. So it can be when your body is still compensating. Your body will change in order to try and achieve homeostasis, which is that state of balance within the body. And as the body quits being able to compensate to keep up with it, then you go into what is true shock. Shock will continue to progress, and the blood circulation will start to slow and then eventually cease. So shock can lead to death. And shock can occur for all sorts of reasons, both medical and traumatic. Some of the big ones: heart attack, severe allergic reaction, motor vehicle crashes, or any sort of large wound that causes massive amounts of blood loss. There's several different emergencies and types of shock that we need to know about, because our patient can go into shock for very different reasons. Perfusion is that amount of blood that circulates within an organ or tissue to provide adequate amounts of oxygen to meet the cell's needs. The body is perfused via the circulatory system. Obviously, your oxygen is going to come from your respiratory system. So those two systems are very intimately intertwined. There are two main circuits within the body: the systemic circulation, which actually goes through the body, and the pulmonary circulation, which goes through the lungs. So those two are just super close together. Any compromise of either of those systems can lead to cellular injury, and then that can go ahead and progress up to cellular death. Adequate perfusion is also needed to remove waste products from your tissues, namely carbon dioxide. And we've already talked that carbon dioxide is synonymous with acid in the body. If we don't get rid of that carbon dioxide, it continues to build and build and build, and that causes blood pH to decrease, which we certainly don't want. Shock is a passive process. So this is how the body moves things around without actually having to have energy. So we talked about simple diffusion, where the molecules move from an area of high concentration down to an area of low concentration. So we've already talked pretty extensively as to how oxygen gets into the blood and CO2 gets out of the blood and up into the lungs. So shock actually refers to a state of collapse and failure of the cardiovascular system that leads to inadequate circulation. This can also be a breakdown of the respiratory system, so you're not getting enough oxygen into the bloods. This can be caused from internal bleeding, which, if we're not adequately assessing our patient, we may miss that internal bleeding. If somebody's got a leg cut off, I mean, that's pretty easy to see. So you need to continue to reassess your patient. How do you know if they're going into shock? Well, they start to look different. They start to look sick. Vitals start to change. First, blood pressure is going to go up, and the heart rate's going to go up as it tries to compensate, and then it's going to start trending down. And how quickly that happens tells you how bad they are. Shock is life-threatening, so you need to figure out what's going on. Otherwise, your patient's going to continue to decline and decline rapidly. Cardiovascular system, you have three parts. You've got the pump, which is the heart. You've got the set of pipes. I also refer to it as the container, which is your blood vessels or your arteries. And then you have the contents, which is the blood itself. The three parts are referred to as the perfusion triangle. When one portion of this isn't working properly, then the other two are going to change to try and make up for that. So if your arteries are not doing well, and that's what's causing the drop in your blood pressure, your heart's going to speed up, and we would give fluid as ALS in order to increase the amount of content. Here is a, picture talking about both systemic circulation and pulmonary circulation. So looking at the perfusion triangle as well, you can see why the heart would fail, the pump would start to fail, why blood would be the failure, why the blood vessels would be the failure, and what loss of that could cause for the patient. If you lose function of one, depending on how bad it is, you might be able to turn your patient around. If you start losing two, the third one follows pretty quickly, unfortunately. To be in shock, one of these parts has to be not working properly or not being able to compensate well enough. So blood pressure. Blood pressure is the amount of blood that's exerted against the arteries at any given time. Your systolic pressure is when your left ventricle is actually squeezing down. So it's going to be higher than your diastolic pressure. Your diastolic pressure is the pressure that's actually maintained within the arteries while the heart is between beats. So just because your heart's not actively beating, there's still some pressure against your arteries on that systemic side. The pressure is, pulse pressure is the difference between your systolic and diastolic. So you're going to take your systolic number, which is always higher, and subtract your diastolic in order to get your pulse pressure. The pulse pressure signifies the amount of force that the heart generates with each contraction. So the closer that is, a pulse pressure less than 25 may be seen in patients with shock. Our typical blood pressure is 120 over 80. So you have a pulse pressure of 40 millimeters of mercury. That's typically normal. Once it starts dropping and those numbers get closer and closer and closer, then you know something's not going right. So blood flows to the capillary beds. This is regulated by capillary sphincters, both before the capillary bed and after the capillary bed. They're under the control of that autonomic nervous system, so involuntary functions. Your capillary sphincters also respond to other stimuli outside of that, which includes cold, heat, the need for oxygen throughout the body, so your body's oxygen demand, and then the need for waste removal. Under normal circumstances, not all cells have the same needs at the same time. So your stomach and intestines have a high need for blood flow after you eat, but if your stomach is empty, it's going to end up making those capillary sphincters activate around the stomach to reduce the amount of blood that's going to that area because it really doesn't need it. Your body's pretty efficient at moving blood around to where it needs it. Now, you're not going to completely shut oxygen or shut blood off because then your stomach's not going to get any oxygen and it starts to die. But it can reduce the amount of blood that flows to the stomach. Perfusion is more than just having that cardiovascular system working. You have to have adequate oxygen entering the lungs and then exchanging at the level of the lungs. You have to have adequate glucose in the blood, and then you have to be able to get that waste out of the lungs. So you have to be ventilating properly in order for all of this to work. there are mechanisms in place to help support respiratory and cardiovascular systems when the need for perfusion of vital organs is increased. So you get scared, you need to run away, you're in the middle of exercising. And so these mechanisms typically are going to come from the autonomic nervous system, and then hormones will also help. When your body senses that your blood pressure is failing, that it's starting to fall, then you're going to have the sympathetic side of the autonomic nervous system. This is that one that controls the fight or flight. It's going to assume more control over your body's functions, and it's going to release hormones such as epinephrine and norepinephrine. Yes, the same epinephrine that we give to patients who are in anaphylactic shock. This hormone goes up to the heart and then causes an increase in heart rate. It also causes an increase in cardiac contractility, so your heart actually squeezes harder. And then it also goes to non-vital organs, so like your skin, your gastrointestinal tract, and starts constricting down. So this leads to what we can actually see in shock. The earliest indicator in shock, the true earliest indicator in shock, is actually increased heart rate. But that can come from being anxious, being scared. I mean, we don't always pick that out as the first sign. So the first truly noticeable sign of shock is when your patient becomes pale, cool, and clammy, because that means the body is starting to shunt blood away from your non-vital organs, your skin being one of those. In talking about shock, there's three basic causes. Either the pump fails, the vessels fail or the container fails, or you don't have enough fluid volume. So some causes of pump failure: heart attack, trauma to the heart, obstructive causes. This leads to a couple different kinds of shock. We've got cardiogenic, obstructive, and then we look down at the low fluid volume. This could be because of trauma to the vessels or tissues, fluid loss from the GI tract, such as severe vomiting or diarrhea. This is going to be more significant in kids than it will in adults. And then poor vessel function. This could be from infection, narcotic drug overdoses, spinal cord injury, or anaphylaxis. And this is typically going to be distributive shock. So you can go ahead and see on your screen the different types of shock. Pump failure broken down into cardiogenic and obstructive. Poor vessel function broken down into distributive. Low fluid volume broken down to hypovolemic. And there's a couple of different subcategories in those as well. And we'll go on to each of them separately. The first one being cardiogenic shock. So this is an inadequate function of the heart, or the pump is failing. The major effect of cardiogenic shock is the backup of blood into the lungs, which results in fluid within the lungs. This is called pulmonary edema. Edema is any presence of fluid, and typically large amounts of fluid, between the cells in the body that causes swelling to that area. The fact that it's in the lungs is why we call it pulmonary edema. Pulmonary edema leads to distressed breathing, which can also manifest by a high respiratory rate and abnormal lung sounds, typically going to be crackles. So you're going to hear like somebody takes a straw and puts it in milk and starts blowing, and you can hear those bubbles. That's kind of what crackles sounds like. Cardiogenic shock develops when the heart cannot maintain sufficient output to meet the demands of the body. So cardiac output is that volume of blood the heart can pump per minute, and it's dependent on several factors. So the heart must have adequate strength, the heart must receive adequate blood to pump, and there must be resistance low enough for it to actually pump that out to the rest of the body.